1 out of 5 women in India suffer from polycystic ovary syndrome. PCOS affects millions of women of reproductive age in India and is a leading cause of infertility. Hi, I'm Sania Mirza, and I take privilege to welcome Dr. Raziya, a renowned health expert who will offer practical strategies to empower women in managing PCOS complications. Raising awareness about PCOS can greatly benefit women due to the numerous myths and misconceptions surrounding the condition. Doctor, can you enlighten us on how a balanced portion control meal can positively impact a PCOS patient?
Sania ma'am, I think it's very important that to understand the diet in a PCO patient, it is very important to know the pathology behind a PCOD patient. So mainly the problem in a PCOD patient is the insulin resistance. So to tackle this, we have to give a diet in such a way that the patient's insulin resistance is reduced and she has a better control of her future diseases. Like the main consequences of PCOD is cardiac diseases, cholesterol, and also these mood disorders, which are mainly because the overeating and snacking is a part of these mood disorders in PCOS. So it's very important that they don't go on a crash diet. It should be a sustainable diet which she can follow throughout her life, even if she is pregnant or even if she is lactating. PCOD is a part of her life. She has to understand that. It is not that she can do a 3-month or a 6-month diet and exercise and be and done with the PCOS. It's very important. I always tell my patients that it's very important that you understand that this is a part of your life. You can't treat it. You have to control it. So what you have to do is, you have to advise her to have a balanced portion meal. That is, she should have an equal amount of lean proteins, antioxidant rich food, dietary fibers, and also have an adequate amount of carbohydrates, because people go on a zero sugar, zero carb diet and they can't sustain it for long. They're too tired and then they quickly go back to their eating habits. So it is important that you have your 5 fruits a day. It could include avocados, cherries, berries, kiwis, fruits like anything which is low glycemic. And it is better to avoid food that comes out of a packet. Cook your meals at home and make sure that you are not eating out of a packet. Make sure that you minimize your eating outside habits out of a restaurant. Cook your own meals, and you can have 3 major meals and 2 snacks. And the snacks should include healthy food. You can have nuts, you can have corn, you can have food like oats. These are low glycemic, quinoa. All these can be a part of your diet, but it should be made in such a way that it should be an Indian diet and it should be a balanced portion control. That goes a long way in preventing long-term diseases like type 2 diabetes, cardiac diseases, cholesterol abnormalities, all this. And also it is very important to have your meal control, and you don't cut down your sugars totally, because the main problem of PCOD patients is they are in always they have mood swings, they're always depressed about they're not being able to follow a diet or exercise. So it's very important that you don't restrict her of anything. Let her have a little bit of everything.
Thanks, doctor. Can you also share how crucial is physical activity in the management of PCOS?
Physical activity also, Sania ma'am, as we spoke about the diet, it's very important that it has to be something what she can do every day. So it can be anything. Usually when we ask PCO patients to exercise, they suddenly go down to the gym and they lose around 10 kgs in 3 months, and then they are too tired, they've lost their muscle strength. So that is not the type of exercise we recommend. We recommend something what she can do every day, like cycling, jogging, swimming, or even walking will do if she's doing it for an hour every day. So either the patient should aim for 30 minutes of vigorous exercise every day, or 60 minutes of exercise 5 times a week. So approximately 150 minutes of vigorous exercise in a week, or 300 minutes of moderate exercise in a week. That goes a long way in the longevity and decreasing these long-term diseases in PCODs.
Thanks, doctor. One more question. What are the important parameters to be regularly monitored in PCOS patients?
Regular parameters that have to be checked in a PCO patient is she has to check her weight often, her BP, and it is very important that she checks her sugars often. So that could be either a 6-monthly thing or at least yearly ones. So when the main problem is insulin resistance, so either you can get your fasting insulin done or you can get a random sugar done, as simple as that. That can be done in any lab nearby to your house. And when you are diagnosing PCOD, it's important that you check your free testosterone levels, because that is the main problem, that is the one which is causing hirsutism in PCO patients. Then you have to have your LH FSH ratios, where there is a reversal, there is a higher LH compared to the FSH. That is the main reason for the anovulation. Then also you have to rule out thyroid disorders by checking a TFT and hyperprolactinemia, which is a very close relative of PCOD. So you have to get her prolactin levels done. All this can be done in a yearly once. When she's planning for a pregnancy, it's important that you evaluate all this and make sure that all these parameters are normal.
Doctor, the clear message for all women is that meal, movement and monitoring are pivotal in managing PCOS for the benefit of women and society at large. Thank you, Dr. Raziya, for your valuable insights which can be vital for effective management of PCOS. As an athlete myself, I recognize the importance of lifestyle management for a healthier tomorrow. Together, we can break the stigma, spread awareness, and support each other in this journey towards better health and well-being.